I'm Fiona Holbrough. I'm a National Programme Lead for Retention at NHS England, and my role is a lead for international retention. So I have been involved in commissioning the research from Huddersfield University on international retention, for working with Victoria and Ed Cox on the development of the Stay and Thrive community, and also with the Commission for NHS Employers on this employers toolkit for international retention.
My name's Wayt. I'm an Assistant Director at NHS Employers within the Development and Employment team, and I have a responsibility for workforce supply, which includes international recruitment. NHS Employers were commissioned in 2022 by NHS England to develop an international retention toolkit. We already have an international recruitment toolkit, which was commissioned by both NHS England and the Department of Health and Social Care. And we also have a retention toolkit that's for all staff. Again, that was commissioned by NHS England. You will find the toolkit on the NHS Employers website. It's a free toolkit open to absolutely anyone. So that can be individuals, team leaders, line managers and employers, and systems as well as a whole. And the toolkit was developed by using the research from University of Huddersfield, which recommended the 6 pillars, which then became the 4 pillars. And the toolkit offers employers guidance on things that they can do to think about. It offers self-assessments. It also shares good practice case studies on what other employers have done. So individuals can watch that and think, actually, that's a really easy thing to do. And we can potentially, implement that at our workplace. And it's also got built in a Stay and Thrive podcast, which again gives really good tips to employers. You hear from a chief nurse and from 2 international recruits who have basically they're part of the Stay and Thrive community. So they're really passionate and give really good tips about how you can help your international recruits to stay and thrive. It's more than just nurses as well. It covers doctors, it covers allied health professionals. So the toolkit is for any professional group to be used across the board.
So I think the starting point is to talk about the self-assessment opportunity. So the self-assessment checklist enables organisations to assess themselves against the key factors that we know support international colleagues to stay and thrive within their roles. So the checklist questions, as I said, are underpinned by the University of Huddersfield research, which started life as a nurse research piece, but we know from Huddersfield that actually those factors apply to all professions. So I think it's an important point to make that actually this guide is for all internationally educated colleagues. The guide, as Michelle has said, is based around 4 pillars. So pillar 1 is creating strong foundations. So this is around considering where and how organisations can offer support. So the diaspora groups, for example, are a really great source of pastoral and professional support. And Michelle made a reference to the international recruitment toolkit. So there's a list of diaspora groups on that international toolkit which organisations can access. Maintaining contact is another area. So engaging with new recruits early and often, pre-arrival welcomes, and getting to know them personally before they come and they move to their new jobs within the UK. Welcome packs, which I know is a really widespread practice amongst organisations, providing information about the UK, about the local area, dialect, organisations, emergency contacts, but also more organisational local things like staff networks and what the sources of support are. Accommodation is challenging for some regions, and there's been a lot of work that's been happening both nationally and regionally around support for accommodation. Some organisations with limited accommodation have found it beneficial to link in with their local university partners And actually in the toolkit, there's a great example from the University Hospital Southampton around what they've done. And then the last point, I think, in this creating strong foundations area, I would mention is about mapping the skill and qualifications to people as they arrive. So we know from the research that over half of international recruits have got over 10 years experience within their role as a nurse. I'm talking sort of the nurse specific research. So actually understanding that and actually making sure that we are able, where possible, to assign them into roles that meet their expertise, their experience, and actually reward their experience, I think is really important to value them, and also to share that learning across the globe in terms of practice and share it amongst teams. The practice has been for nurses, for example, to kind of start people on the band 5, you know, even regardless of their level of experience. And I think there's been lots of work happening nationally and locally to tailor approaches now to individuals and actually to understand, you know, to get to know and understand that prior experience learning. There's the Accelerated Development Fund that the Nursing Directorate offered out to actually help support organisations to think more innovatively around those processes and how they can make those cultural shifts.
It's also about making sure you just think about the basics. So, you know, somebody to pick them up from the airport, getting them a SIM card for the mobile phones, opening a bank account, registering with a doctor and a dentist, just those things that we might take for granted that actually are big things when you come from a different country. So think about that, and also use your staff who might be in the community to also make individuals feel welcome. They might already be from that, you know, international, they might be an international recruit, and they know how it was for them. So I think, you know, the chief nurse on the Stay and Thrive podcast talks about that, and how actually you don't have to have the answer, but there will be answers within your team.
Pillar 2 then, so there's 4 pillars in total. So pillar 2 is about making new recruits feel welcome. So moving on from that, building foundations, to actually helping them settle into their new communities by, as we've said, pointing them towards those local services. So support to set up bank accounts, where they found their local GP, their dentist, somewhere to live, access to shopping, schools, public transport, and other amenities. So that's a big area to help support with information and navigation. That pastoral support offer beyond induction, so including the social networks and how, you know, people can build those relationships and friendships with new colleagues and new individuals within the community. Preceptorship is an area, so thinking about how we tailor the existing preceptorship programs to actually meet the needs of people who actually have got experience but are still new to the NHS. Buddying, so existing staff who have lived experience of relocating to the UK, you know, there's a great opportunity to buddy people up there to provide that support. You know, all organisations now have corporate induction, so again, it's just that nuance of what are those unique needs for an internationally educated colleagues, and that signposting to the professional bodies, the professional associations. The GMC, I know, run a really great workshop which is free to help settle medics into the new careers within the NHS. Welcome events are something that are becoming increasingly more popular, and we're even seeing welcome events at system level. So you know, as we've got the scale of international recruitment that we've got, and celebrating throughout the year. So for example, with OSCE exam passes, I know that's, you know, a real milestone for people, so celebrations for those, and considering how those can be done collaboratively. And then the last area, I think, just to point out with it, and this is a theme that runs through them all, is health and well-being. Actually, you know, what is the local and national offer for health and well-being? Having those individual conversations to tailor them to meet the needs of individuals. Building belonging then is really, it's about the safe spaces, so forums or staff networks where we can listen and understand the experience and then help influence employers to take action around that. The integration, we've talked a little bit already about. Staff may arrive with their families, so we'll need further support around integration into the wider community, building relationships with local faith leaders, schools, colleges and local services, and providing that support to transition into a new culture for the whole family, I think is an important point to make. Cultural awareness training, back to that kind of understanding, different cultures. And NHS England is developing an online training for line managers and internationally educated staff to give greater awareness of different cultures. And I know there's some organisations like BARTS are doing lots of work around cultural intelligence and educating managers and the wider workforce to support that area. And we've already touched on celebrations, but again, I think this is an important aspect of belonging, actually acknowledging cultural holidays and events celebrated by international staff, celebrating their achievements to build that sense of belonging and connection to the organisation, and sharing their culture and traditions with their colleagues and vice versa, so that you start to kind of build that understanding and those relationships. So those are the areas that, come through in the toolkit around building belonging. So the fourth pillar then is about maximising personal and professional growth to ensure that we can support people to fully realise their potentials. We know from the research that one of the key drivers for migration is for career development and career progression within the NHS. So some of the tools that help enable this within organisations are career conversations, so understanding future aspirations and how individuals can be supported through the various clear career pathways. Holding career clinics with groups of international staff can widen their understanding of the available career pathways, where to find roles, how to access education, how to successfully apply an interview for a job in the NHS, and also considering how to use interview feedback and training to help people, who aren't successful the first time and need some more support with those skills. So that's one area. Leadership programs. We know the Leadership Academy have a really great suite of leadership programs that they offer. The Edward Jenner for first line managers, Mary Seacole, and then Nye Bevan, and it goes on. So they're the national offers, and there's coaching offers as well. And then we also know that organisations more locally have got their own development offers to support career progression to move up and into those management positions. And I think the last two things I would say around this area again is that ongoing health and well-being. People need to feel well and resilient in order to be able to feel able to personally and professionally grow, and the importance of role models. We often say, you need to see it to be it. I think is often something that is said, and that comes through the community really loudly, and how powerful those role models are in leading this agenda. And we've got 4 international nurses who are working with the Stay and Thrive Leadership Group to help support embedding this. And actually, it really enables us to share that. And mentoring as well, of course. Mentoring is a really important aspect of personal and professional growth for individuals. So access to coaching and mentoring schemes is key.
There's some really simple tips and hints in there that any employer could implement very quickly and easily, and with limited resources. So I think definitely the toolkit can that self-assessment of going through and saying, okay, where am I, what could we do, what resources do we have available, and what's actually going to really help the individuals. So I think the toolkit is designed in that way to allow for you to either implement little things that are just going to just help somebody either come into the country or to stay and to thrive, or you can go as a system and do quite a real overhaul of your practices, I suppose. So it's designed in both ways to allow that.
Yeah, I mean, on the point of roles, you know, we heard last year that there are some stay and thrive roles actually within organised, you know, they're actually called that, which is an amazing achievement for the community to kind of filter into that level. So hearing stories like that are really, really powerful. And I think what we would like to see, obviously we've got the national community where we have learning events every so many months, and we've got the national resources, but we'd like to see that collaboration at system level. So actually having systems bring their organisations together and thinking about primary care and social care, and forming those relationships, and thinking about offers that can be made collectively to help support internet and those career pathways. So there's so much scope for improvement. I think, you know, I'm sure everybody would find something that would add value to the work that they're doing, and just to say, keep up the great work.